Good morning, everyone, and welcome to our Being Caregiver-Friendly Caregiver Assessments and More webinar. We're really thrilled to have you here. While we're waiting to get started and while people are getting settled, we certainly invite you to check in the chat box and let us know where you're from, and if you're so inclined to share your position or a title and from which health authority you're calling in from. I'm Wendy Johnstone. I'm our Director of Programs and Innovation at Family Caregivers of BC. We have Stacey Dawes on the line too. She'll be in the background monitoring the chat box. We've got a cold. She normally co-presents with me. And we have we've got two guests from Island Health. We have Emma Payton, the Clinical Engagement and Quality Lead with Seniors Health and Community Virtual Care, alongside with Jamie Fries, social worker with the Community Virtual Care, and they're going to be providing and sharing some insights around the Caregiver Support Program towards the end of the presentation. So we're thrilled that you're here today and look forward to the presentation. Just checking my time. We've got 1 minute before we get started. And yeah, we're excited to be here today. We really enjoy our healthcare provider webinars. The feedback that we get is really positive, some really great questions and discussions around how we can be caregiver friendly across all system levels. So it's 11:15 and we will officially start our webinar. I'd like to take a moment to acknowledge the land that I'm on. I'm extremely grateful to live on the traditional unceded territories of the Comox First Nations up here in the Comox Valley. I'm very thankful for their stewardship and protection of the water and the earth, and for their generosity of spirit with which they have shared some of their teaching. I'd also like to acknowledge the Kwangan people, also known as the Songhees and Esquimalt First Nations communities, for their stewardship, care, and leadership on the land called Victoria, where our main office resides. We're from Family Caregivers of BC, and we're a nonprofit charity that's dedicated to the well-being of family caregivers of BC. We are 100% dedicated to family caregivers. We're turning 35 years this year, and we've been serving caregivers across BC since 2010, and we're also part of the Ministry of Health Patients with Partners initiative. We have 3 pillars: our caregiver support, which provides direct one-to-one service for family caregivers through our caregiver support line, follow-ups, caregiver coaching. We offer peer support groups. We have a fantastic online resource center. And our second pillar is education. And we have a wonderful website that's dedicated, our learning center, through videos and podcasts and articles and blogs. And we have a newsletter publication. We also provide training for support group facilitator training, and we do some outreach to community groups. And our third pillar, which relates to our webinar today, is our engagement and collaboration. And it's really about engaging with healthcare professionals with the intention to provide education and information on ways that we can support you and the work that you do with unpaid family and friend caregivers as partners in care, and helping them to identify as family caregivers and provide support and referral. So today, this is our second webinar of our Being Caregiver-Friendly webinar, and we're going to discuss the importance of assessing the needs of family caregivers. And so we're really going to focus on why it's important to assess and monitor the needs of family caregivers, independent from the care recipient. To quickly touch on the importance of the patient, family, and provider equation, to learn about different types of caregiver assessments, how to identify and refer family caregivers for support. And we are going to have Emma Payton and Jamie Fries join us from Island Health to highlight how the Community Virtual Care Caregivers program treats caregivers as their own clients and how they are supported in their role. At the end of the presentation, we'll have a time for some questions and answers. If you do have questions, though, feel free to pop them in the chat box. We always like to start our webinars with a really quick overview of what family and friend caregivers mean. And it's really about providing care and support to someone living with disease, disability, or frailty due to aging. And family and friend caregivers are very diverse, yet they share a common purpose. They come from all cultures, ethnicities, socioeconomic, and educational levels. Their neighbors, their friends, their sons, their daughters, sisters, brothers, grandparents, grandchildren, spouses, etc. And caregiving is not done for financial compensation nor for pay. They really take on this role because they feel a need. They're called to it by the relationships they have with their care recipient. And caregiver-friendly healthcare is really this idea of looking at a healthcare system that sees a patient and family as a whole team. And this idea of how we can identify, include, and support family caregivers. Because when we know that when caregivers are identified and offered support and treated as a member of the healthcare team, everybody benefits from that. And caregivers feel seen, heard, and appreciated in their role. Supporting family caregivers is one of the goals of the Ministry of Health. Better health, happy people at an affordable cost. 27% of British Columbians are caregivers. Our healthcare system relies on them to the tune of $14.7 billion and 864 million hours of care. So simply put, our system of care could not survive without family caregivers. So we need family caregivers. Over 80% of care is done by family and friend caregivers. So the top of the iceberg represents what our society sees in terms of care, the formal delivery of healthcare services. The bottom represents the care being provided by caregivers, huge at 80%. Sometimes it is invisible, below the surface, and unrecognized. And for every hour the public system provides, the caregivers provide 10. I wanted to demonstrate an example of often what we might hear from a caregiver on the line, that they'll talk about their situation and the person they're caring for, and using this example. This is actually also from the Seniors Advocate of BC around one of their most recent reports in 2023 around how we must do better home support services for BC. And so this is a very typical, this could be a very typical care recipient, 84 years old at home, they live alone. We see that 46% co-reside with a primary caregiver, that the senior is dependent in activities of daily living. They might have, cognition difficulty. 55% of, in cases, they're high risk for long-term care placement, and 34% have a caregiver who are in distress. And so if a caregiver is caring for someone, for a senior, just with these characteristics, what we see is that they're at incredible high risk of burnout, mental, physical, emotional, and exhaustion. And so it's really taking a toll on family caregivers. So engaging patients and caregivers is really essential to self-healthcare and really good health outcomes for both the patient and the family caregiver. The patients and caregivers bring valuable insights and lived experience to this equation. It's only through the combination of patients, caregivers, and healthcare providers that we can become partners in care and really achieve these powerful results of better outcomes for everyone. And not only does it make good sense, it's actually the right thing to do. And caregiver assessments are one tool to include caregivers as part of the care team. So assessing family caregivers. As a healthcare professional, you access and assess patients all the time. It isn't necessarily the norm or standard practice to assess the patient family caregiver, except perhaps to identify them as a resource or as an informal support when looking at a transition or a discharge or a care plan. So in this traditional view, family caregivers, they're not clients or they're not necessarily the official part of the healthcare team. And so it typically can lie outside of the realm of professional responsibility. But caregiver assessments are a tool to really help identify strengths and limitations and to develop plans of care to help bring a team-based approach to providing care to patients while supporting family caregivers. So assessing family caregivers, they're really used to ensure that the patient's health and well-being are maintained and enhanced, that they're ensuring the caregiver's capacities and needs are considered and addressed in a care plan, and they can actually really help monitor caregiver well-being throughout the caregiving trajectory. Caregiver assessments are systemic in the sense that there's a way to gather information that describes the caregiving situation, and it can identify particular challenges, resources, and strengths of the family caregiver. It really focuses on the caregiver, not the patient. And the process really recognizes that there's both gaps, but also and needs, but there's also strengths that the caregivers bring. Caregiver assessments are actually a really important source of information for providers and for caregivers themselves, especially during transitions from one care setting, or if a illness was progressing, or through an initial diagnosis, and that they really can help identify areas for additional support and follow-up that caregiver needs, as well as supporting the care recipient in their environment of choice. So if you have a chance, if you are currently using a caregiver assessment, we'd love to hear about that in the chat box. Feel free to send a note and share with our other attendees. So the other thing I guess about caregiver assessments is that sometimes they can be really brief, but they can still really help raise a number of questions or areas that family caregivers can discuss. Often one of the only times that a caregiver can speak to their own current situation, and perhaps where they have the opportunity to express their own concerns about their own abilities to provide care, or the areas where they can use more support. So some common caregiver assessment tools. The column on the left was actually a column that was developed by Elaine Book from our first webinar. And she spoke about this idea of a mental checklist for healthcare professionals to be mindful of these factors that can contribute to caregiver strain. And so she had listed these really important points, and to think about the change in or presence of, as a bit of a flag to either note in the file or to have a conversation. So I left that in there because I thought it was such a great list that she had provided. Many caregivers don't see themselves as caregivers, and especially if they're not doing hands-on care. And so as healthcare providers, you are in a great place and opportunity to educate caregivers on the many ways they do provide care, whether it's practical, emotional, social, decision-making, organization, advocacy. And to help caregivers self-identify, using a caregiver assessment tool is a perfect way to help bring light into that conversation, or identify ways that they could receive more support or refer them into services. So there's many long established tools, and there are others that are very more disease specific. But I just wanted to highlight 6 caregiver assessment tools that are commonly used in healthcare settings. So the Caregiver Strain Index. Actually, what I'll mention is each of these are linked, and so when you receive the presentation, the link will actually take you to the tool. But the Caregiver Strain is a 13-question tool that looks at strain in care provision. It's really easy to administer and score, and it really helps identify a family member that would benefit from a more comprehensive assessment. The Modified Caregiver Strain Index is actually a modified version that Interior Health currently utilizes. It has the caregiver complete a 13-question caregiver strain index, and then the healthcare provider completes the caregiver risk factor screen. And so together, it really helps provide this decision-making criteria for follow-up, or referral into programs for both the patient and caregiver. So that's a really great tool to take a look at. The Caregiver Self-Assessment Questionnaire was developed by the American Medical Association. It's an 18-question tool to really help caregivers become more aware of their own well-being and offers some steps and resources. It could be like a really good waiting room tool, or even in a support group. The Zaret Burden, it's widely used. It's one of the most widely used. It's a short 12-item version and a 4-item screening version. There's 2 of them. They have both been found well to correlate with the full 22 version. It can be a very helpful screen and a resource tool for caregivers and their families. The CARE tool, it's a very, very extensive tool. And it was really developed to systematically evaluate the needs of caregivers themselves. It's composed of 10 sections that cover different aspects of a caregiver situation, plus the summary section. And so it's often a tool that really gets in at the comprehensive needs of family caregivers. And the Inter-Eye Self-Reported Care and Needs, the SCAN assessment, was designed to evaluate the health and needs of caregivers. And it can be self-administered and then reviewed by the healthcare provider. So bringing caregiver assessment tools into our team, into your team, is something that would really, help elevate how caregivers can be included as partners in care and see them as an individual user of the healthcare system. I wanted just to show what the Division of Family Practice in Powell River developed in one of their initiatives. It was an initiative, wraparound services for frail seniors and their caregivers. They developed some flags for caregiver burnout. And it's another even great way to bring awareness into a clinic or healthcare team around providing support for family caregivers. If you want more information on this, we're happy to send out the link as well in our follow-up email tomorrow. But just wanted to show that there are some other ways outside of pure assessments, caregiver assessments, even just having, for example, a great tool for healthcare providers to have on hand to quickly scan is also really helpful. This idea that formal assessment, sometimes that's not necessarily available in all healthcare settings. And so even having one question can be a really great caregiver assessment. And so this idea of engaging every caregiver every time is really about recognizing and identifying family caregivers and asking them how they're doing. So sometimes just asking them this one question of how they're doing today, how they're managing, what would be the one thing that would help you most in caring for your friend, is really about building a relationship with those family caregivers and being able to take the time and genuinely listen to the caregiver and their response. And just a reminder, we focused on this in our first webinar, but we have there's 3 simple tools for referring family caregivers. We have Pathways, which you can go onto the system and it actually will take you to the online referral form. We have a consent referral, in which case the healthcare provider receives consent from the family caregivers, fills in the caregiver referral and consent form and sends it into Family Caregivers BC. And then we have our 10-second handoff, our caregiver prescription pad, where a healthcare provider can tear off an information sheet for the family caregiver to then take the initiative and call Family Caregivers of BC themselves. And so those are some 3 simple tools for referring. Sometimes healthcare providers don't feel they can fill a gap, or they're not sure how to fill a gap with a family caregiver. And so these are some ways to be able to provide support and refer family caregivers to get the support they need in their role as a family caregiver. I'd like to introduce Emma and Jamie, who are going to provide some great some great knowledge and experience from the Community Virtual Care program. So Emma Payton is the Clinical Engagement and Quality Lead for Seniors Health and Community Virtual Care and Island Health Department. She holds a bachelor degree in social work and master's degree in healthcare leadership, and she's worked with hundreds of caregivers throughout their career and is very passionate and proud about the Caregiver Support Program. And Jamie Fries is a registered social worker with Community Virtual Care Caregiver Support Program at Island Health, and she's been in the field of social work since 2008 and has practiced in palliative care, acute care, community, and long-term care. Previous to her experience as a social worker in healthcare, she worked as a care aide in the community and in long-term care for several years. She is really proud to have developed a great respect for caregivers and recognize the importance of supporting them as an essential part of the healthcare team. Thank you so much for being here today and sharing your experiences. I will turn over the presentation to you both.
Thank you so much, Wendy. It's great to be here, and thank you everybody for letting Jamie and I talk about our program. So Wendy, am I able to forward like this advanced slides, or do you do that for me? There we go. Okay, so Island Health has a program called Community Virtual Care. It's a free Island Health program we use for remote patient monitoring, virtual visits, and the telephone to support clients. We have 4 care areas, but one of those care areas is the Caregiver Support Program. So in probably conversations started in about 2021 in Island Health, looking for a way to support caregivers as individuals, as opposed to, as Wendy said, as part of the person being cared for. So individually looking at their needs and providing support separately for them, apart from the person they're caring for. So the Caregiver Support Program was developed in 2022 with the support of Dr. Liz Drance, the BC Family Caregivers, Alzheimer's Society, and a number of the sort of people that were involved with caregivers within Island Health, as well as we had some caregivers themselves participating in the development. So what came of that was the goal was to try and create a program that didn't overlap the services or didn't replicate the services that already exist in the community. We wanted to create something that was different and enhance the supports and worked in tandem with the supports that currently exist. And so what we developed was a completely virtual program, and it is considered a time-limited program whereby we offer 3 service streams, which I'll tell you about in just a moment. We began accepting clients into the program in November 2022, and it was a little bit of a slow start. We had 1 social worker providing care, but that quickly ramped up as word got out. And so we now have 3 full-time social workers in the program and some casual support as well. So in 15 months, we've supported more than 225 caregivers in a variety of different ways. Caregivers tend to be on the program. Our stats kind of look as if people are on care for about 4 to 6, sometimes 8 months, and some are less and some are longer. Next slide, Wendy. And so the program works with caregivers to strengthen emotional well-being and coping skills and help caregivers to set goals. So the 3 service areas are brief one-to-one counseling, flexible rotating skill building group, and facilitated peer-to-peer support groups. In terms of the content for the skill building groups, there's four sort of classes, if you like: developing emotional awareness, connecting with grief and loss, working wisely with stress, and enhancing well-being and physical health. And so participants can sign up for them. They're provided over Zoom for Healthcare. And the feedback we've been getting is quite phenomenal, actually. People feeling less isolated and less alone because they're meeting people who are in similar circumstances, maybe having similar feelings. And just that opportunity to connect with others without having to leave the home, which for many caregivers is a big challenge, especially for caregivers who are living in very rural and remote communities. On Vancouver Island here, we have people spread out quite widely, and we've got people in tiny little villages, I would say, and they can participate just as easily as anybody participating in downtown Victoria. So in terms of equipment or technology for the one-to-one counseling, all that's required is a telephone. And for the skill building group and the peer support groups, access to a computer is necessary. And next slide. In terms of referrals, we accept caregiver referrals from the client themselves or from another person. Caregivers are sometimes identified in acute care, primary care, long-term care, and community care. So we receive referrals sometimes from doctors, from other community agencies. We may have a client in one of our other programs, maybe our virtual supportive care program, and the nurse identifies that the caregiver also needs support. So we may receive referrals for clients that way. And we are as low barrier as we possibly can be. So we will support caregivers, by telephone as best we can. There's sort of no expectation that people live in a certain community. We are a regional program, so no matter where they are, we can provide that support. And our social workers are located in the communities that they live in. So, it's also wonderful, I think, wonderful work for our social workers because they get to work from their home offices and support patients, clients wherever they happen to be. Next slide. So now we're going to hear from Jamie. She's going to talk about some case examples and maybe some tools used. Thanks, Jamie. We can't hear you, Jamie. You're on mute.
Thank you. Yeah, so just speaking to the assessment tools that's referred to earlier, we're using the modified caregiver strain index, and we also have caregiver self-assessment that we're using. But when we do engage clients and connect on the phone or via Zoom, yeah, we're using that assessment to see where they're at in their caregiver journey, what kind of strain they're experiencing. And like Emma had said, it's been very valuable, the one-on-one counseling support we're providing. We have the skills building workshops that we rolled out last year to start, and it's been very successful in terms of the response. And one that sticks out for me that we're that we're doing on a monthly basis is the emotional awareness, developing emotional awareness. And the methods that we're using and the feedback that we're getting from caregivers has been so positive. For example, even just simple concepts like we have a feelings wheel that we use in one of our presentations, just identifying the 6 core emotions and what feelings are related to those emotions, having interactive conversations and reflections from caregivers where they have the opportunity to connect with each other. I just have some quotes here from some of the caregivers in terms of just the wheel itself. One caregiver said, "Oh my God, I was so happy to connect with others who are going through the same struggles that I have to face on a daily basis. And I realized that I was not allowing myself to feel my feelings as I am not the sick person. The result being that I was becoming resentful and angry inside." So that was just one of the comments we had back from one of our caregivers. And an extension of that tool we used another method in our workshop called the RAIN method, which is helping caregivers identify the emotions that they're and the feelings that they're experiencing, sitting with those emotions, allowing them to be, and kind of being curious about it and seeing what's coming up for them and what they need. Then we get into the self-compassion piece, which is so helpful for caregivers to be able to be in a safe space to reflect on how they can be kind to themselves. And the quote that I have to reflect that method is, a caregiver said, "I learned the RAIN method, and I'm applying this to my everyday life. There is strength in knowledge, and this enabled me to understand my situation better and ultimately cope better." So there's just two examples of caregivers and what they're, reflecting back to us, and we're just so proud to be able to support. And I'm very happy to be part of this program.
Thank you so much for for providing those quotes and examples of some of the tools and resources being used in the program, and for the actual overview of the program. I know just our team, we have been vicariously watching the program unfold, and it's been really exciting. It's been such a real innovative program, in our province, and so thrilled that we are able to refer caregivers into it, and that we can provide a wraparound service for family caregivers on Vancouver Island. So absolutely wonderful. I see that we're right up at our finishing time at 11:45. I just wanted to leave people with a slide that, if they're interested in ordering some caregiver RX resources through Family Caregivers of BC, that we have a link to do that, and you'll be able to see that in the slide presentation tomorrow. We'll continue to have the slide will be able to show all the information on Island Health program. It looks like Stacey's been putting lots of examples in the chat box, so we'll just make sure that those are included as well for everyone. I wanted to thank everyone for joining us today on our webinar, our second in our two-part series. We're really thrilled that you were able to join us. If you have any other questions or comments, feel free to contact myself. And if you have a direct question for Emma and Jamie, please feel free to reach out to them directly, or we can certainly pass on any messages as well for our two presenters. So again, thank you so much for joining us today with Family Caregivers of BC. A huge thank you to Emma and Jamie for their time. We really appreciate their time and expertise as well. I hope everyone has a wonderful day and a wonderful rest of the week.